unusualities or mga abnormalities. So, bantayan dyan nato ni siya nga mga example. And then also, we will write there the vital signs like again, the BP, temp, mga and so on. So, pero ilagay lang ang mga unusualities, yung mga abnormal na mga result. Wag na yung mga normal BP result and so on. And next is the labs and diagnostics or the surgical procedure ordered. So there we will put the, for example, mga CBC or X-ray if na-receive na ba nato ang result or to follow pa ba, mga inana. Next is the evaluation of how medical interventions work. And then the patient's subjective data or complaints. Next is the intervention rendered like yung TSB, bedside care, for example, ang linens gi-stretch mo and natak well. Next is the doctor's visit. So here, maglagay tayo ng statement if na-visit ba ni doctor ang patient or nasiba niya or na-assess. And then next is the instructions or education. Ito yung mga health teaching sa patient mo. For example, ma'am, kailangan mo increase ng oral fluid intake or i-instruct mo si patient na, ma'am, kailangan mo rest and sleep. So, yung mga gi-instruct mo kay patient, write mo doon sa nurse's notes mo. Then, also, you will put your nurse's name and signature. So, first, mauna muna ang signature ni student nurse, followed by CI signature, then the nursing on duty or NOD signature. So, if 2 pages po, next slide po please. So, if 2 pages po ang na-occupy nyo kasi mataas yung nurse's notes nyo, kailangan 2 signatures ang malagay. So, sa first page malagay nyo ang signature nyo. And then, sa second page na po, maglagay naman kayo ng another signature. Pero if ang continuation is only at the back of the first paper, so only 1 signature lang ang kailangan. Then, next slide please. So, the order of the nurse's notes. So, first is the orientation of the client. So, mo na yung una nimong ibutang. So, pag-receive, unsa may mo ma-assess, pag-receive nimo sa patient, awake ba siya or conscious or kanang ano ba siya, kanang dili ba siya, unconscious ba siya, ana, ibutang nimo dito. And then, next is the cephalocaudal assessment of the client or yung head to toe na assessment mo. Like, naa ba siya attachments, katong mga cyanosis sa iyang body or hematoma, ana. Then next, you will put the IVF, so or the intravenous fluid. So ilagay din doon ang type ng IVF. For example, plain lactated ringer ba siya or plain NSSS, ana. Then ilagay mo din ang rate. So for example, ang rate niya is 80 cc per hour. And then ilagay mo din ang IV site. So saan mo nilagay na vein? For example, sa left metacarpal vein, ana, or right metacarpal vein. And then, ilagay mo din ang intake. Next is the VS. Again, yung unusualities lang ang ilagay. Then, also the health teachings, yung increased oral fluid intake or kato mag-rest, advice to rest, mga ganun na mga health teachings. And then lastly is again the nurse's name and signature. Next slide please. Next slide pa po. Ayan po. So there, sa sample na nurse's notes, makita nyo may patient's name, ilagay nyo dyan, tapos kung saan siya na ward, then room and bed number. And then here sa first na column, makita nyo ang date and time. Ang date lang pala. Tapos, the second column is the time, and then the third column would be the interventions that you have rendered to the patient. So, di ba, nauna ang kaning kung unsay mong na-assess sa patient nimo, kung unsa ang iyahang status, for example kani receive lying on bed, conscious si patient, so mata siya and coherent and responsive siya sa stimuli. So for example, nimo siya i-pinch nimo yung nail bed. So kung ano siya sa pain o kana mo mo respond siya may siya sakit ana. So responsive siya sa stimuli. Then sa physical assessment from head to toe, you have pinkish palpebral conjunctiva, tapos may attachment siya, the auto inhalation, yung nasal cannula, then also naapoy symmetrical chest expansion for the physical assessment, and also the IVF here, the PNSS, and also the health teachings. We have on moderate high back rest position or on low salt, low fat diet, and then the VS here and the medications given, also the doctor's visitation include pud niya daraa and attachment na pod kaning Foley catheter, and also the health teachings. Next slide, please. Then, muna ni siya left on, lastly, there is a left on bed, comfortably resting, muna siya with no unusualities noted. Pwede niyo siya ilagay pag after na mo mag-render og care sa iyaha. Then, inyuhang name, the student nurse, ang CI signature and name, and the nurse on duty signature. So that's all po. Thank you.
Okay, thank you, Miss Salanatin.
Thank you. Yes, po.
Sige,
Sana lang
meron
po.
pa na.
So thank you, Ms. Salanatin. Now we are going to be discussing about the FDAR, or the Focus Data Action Response. So this is also another type of charting that we nurses will be using. And correct me if I'm wrong, ma'am, and na ito yung ginagamit na charting sa SPMC. Tama po ba? Yes. So later malalaman natin bakit ginagamit siya sa SPMC. Pero before we proceed to that, gusto ko lang sana mag-add content doon sana sa nurses notes mo, because this is what I've realized and I've learned during the course of my nursing journey. Charot. Importante talaga, guys, na as nurses we will that we take care of our notes, our documentation. Story to sa aming CI dati, the importance of noting or note taking. Di ba usually, di ba, in your funda, di ba, whenever we leave the patient's room or whenever the patient is in the bed, yung unconscious yung patient or comatose yung patient, what do we always do? We raise the side rails, di ba? So yan, we always note that sa ating patient's chart, sa ating nurses notes na we raise the side rails, so that malaman, if ever what happens to that patient later on, may proof tayo na, gi-raise talaga to ng side rails. Ni nurse yung side rails. So, by instance daw dati na, si nurse, gi-raise yung side rails, ginote niya yan. And then, later, natingala lang siya, nag-call yung room na yon doon sa may call button, di ba, sa room. So, they've alerted the nurse station na, hala, may nangyari, something like that. So, yun, natumba si patient. Tapos, hala, bakit natumba si patient? So, sino ang unang i-blame dyan? Of course, si nurse. Kasi ikaw man yung nag-aalaga kay patient. And then, bakit napabayaan si patient, bakit lang siya nahulog dyan? So, of course, ikaw, wala ka ba ng proof na, hindi mo pwede sabihin na gi-raise ko man yung side rails kanina, tapos pagtingin sa nurse's notes, wala ka pala naglagay ng nag-raise ka ng side rails. Tapos hindi ba yarat ng private room na merong CCTV kasi may patient's privacy rin ba yan siya, di ba? So, dapat talaga, every intervention that we do, every action that we do to the patient, we write it in the nurse's notes. Kaya para if ever may gawin later na hindi tayo yung naggawa, meron tayong proof na hindi tayo yung may kasalanan. Ganun lang. So, Focus Data Action Response. Next slide. So focus charting describes the patient's perspective focuses on documenting the patient's current status, progress towards goals, and response to intervention. So ang kagandahan itong FDAR compared to the yung narrative na nurses notes, medyo short na lang to siya kasi mag-focus lang siya doon sa importante na parts. Malaman natin yan later sa next slide. So what its purpose? It is to easily identify critical patient issues or concerns in the progress notes. This will facilitate communication among all disciplines to improve time efficiency and documentation, to provide concise entries that would not duplicate patient information already provided on the flow sheet or checklist. So dito kasi sa FDAR, like I said kanina, mag-focus na siya sa problem. Tapos yung anong ilagay na interventions doon sa third na column, yung mga interventions lang that will solve the focused problem. So usually ginagamit to siya sa mga busy na hospitals, for example SPMC, kaya para makita kaagad ng mga ng health team kung ano yung mga problems ng patient na ito yung problem niya ngayong araw. So ito dapat yung magawin ng mga interventions or kung ano yung ginawa ng mga colleagues nila. So madali lang siya makita. So makita tayo later ng sample kung gaano ba talaga siya kadali. Next slide. General guidelines. So focus charting must be evident at least once every shift. Focus charting must be patient-oriented and not nursing task-oriented. So example, si patient kay nahihirapan siya maghinga. So what you do sa FDAR, of course, maglagay ko doon difficulty in breathing, ganun. So lahat ng mga interventions na gagawin mo para lang doon sa difficulty of breathing. And then indicate the date and time of entry in the first column, and then separate the topic words for the body of notes. So, focus note written, pa-mute lang po. Sir Caldalo, yeah, thank you. So, first, focus note written on the second column. Diyan na natin diyan yung problem talaga ng patient na nararanasan niya during our shift. Diyan natin ilagay sa second column. Then on the third column, we will be writing the DAR, which is the data, action, and response on the third column. Then at the end, we will write our sign or our name, like Raymond, Reddington, or N, or for our sake, para sa atin, Luis Andrew Rivera, STN, or student nurse. For every time we enter an entry doon sa FDAR. Next slide. Document on only patient's concern and or plan of care, like health teaching per shift. Hence, general notes are not allowed. So, yung mga importante lang ng mga data, hindi na tayo maglagay na ipalong ang aircon or naguba ang remote, because dapat mag-focus na tayo dun sa condition ng patient. Document patient status on admission for every transfer to or from unit or discharge. So, if you're going to document patient status. Okay, so kung example, merong mag-admit, so we have to assess, pati ito rin sa ibang charting na when we receive a patient, katulad ng doon sa nurses notes kanina, we receive the patient lying comfortably in a supine position or what, then i-note rin natin kung meron bang i-add ng mga accessories or devices sa patient, kung may IVF ba siya or what, and etc. Then follow the dues of documentation, which I will be discussing later on, and then use black or blue ink of ball pen for AM or PM shift. So black for morning and then blue for PM shift. Then red for the graveyard or the night shift, which is the 11 to 7, or according to hospital policy. Focus charting part. So as I said earlier, there are 3 columns usually used in focus charting for the documentation. And in those 3 columns, there is the date and hour, the focus, and the progress notes. So yung DAR, makita natin siya in the following slides. Okay, here, ito yung sample ng FDAR. There are only 3 columns, and then ganito lang din siya kaliit usually. So sa first column, dyan natin ilalagay yung date and the hour. So here we see March 7, 2010. Matagal na masyado ito na FDAR. And then 8 p.m. So kung kailan niya yan ginawa na note. So since 8 p.m. to siya, PM shift to siya. So next, sa second column, ilalagay natin dyan yung focus of care na for this sheet natin ilalagay. So the focus of care, this may be a nursing diagnosis, a sign or a symptom, an acute change in a condition or behavior. So yan yung ifo-focus natin kumbaga sa patient. And then sa progress notes, dyan natin ilalagay yung ating mga interventions or ating management. So dito data, action, and response, which I will further discuss in the succeeding slides. So focus or yung ilalagay natin sa ating second column. So in sa ating focus, we identify the content or purpose of the narrative entry and is separated from the body of the notes in order to promote easy data retrieval and communication. So, this could be a nursing diagnosis, example, ineffective airway clearance. And this could also be an event like admission or transfer to another ward or discharge, teaching, ganun. And then, or patient concern, which could be like code blue or vomiting or coughing. So itong focus, we can imagine this as like yung CC, yung or yung subject na ano, sa when we make may emails, 'di ba? 'Di ba may subject tayo na bar sa taas. So diyan natin malalaman natin yung topic kagad or like yung focus natin for our intervention. So yan yung ilalagay natin sa ating second column. Next slide. Next is the data or data. Write your assessment cues like vital signs, behaviors, and other observations noticed by the patient. Both subjective and objective data are recorded in this data category. So this is written in narrative form and contains only subjective or objective data or yung cues natin. And this lays the supporting evidence for why you are writing the note. So example, kanina, ineffective airway clearance. So pasabot kay clogged yung yung airway, siguro taas kayo yung sputum or something. Marami masyadong phlegm. So siguro pwede natin ilagay na vital signs kay since compromise yung airway natin na bumibilis yung heart rate, yung respiratory rate ni patient in order to cope for the lack of oxygen. So doon na natin makikita na tinuod jud ay na ineffective yung airway clearance ni patient kasi nagtaas yung respiratory rate niya. Or kaya kung merong sputum, pwede natin doon ilagay yung yung color of the sputum or gaano kadami, gaano ka-viscous yung yung sputum. So diyan natin ilalagay for our subjective and objective cues. Ano pa ba? When we write the data, we do not hindi siya pa-bullet, narrative form pa rin to siya. So an example is yun, basta narrative siya. I-narrate lang ninyo yung sinabi ko, ganun yung siya ilagay sa data. Then next is the action. So in our action, it reflects the planning and implementation phase of the nursing process and includes immediate and future nursing actions. It may also include any changes to the plan of care. So usually here we put our verbs or our action na words. For example, yung balik tayo sa ineffective airway clearance. So what did we do in order to solve that problem? So baka nag-suctioning tayo or what? Yun. So next guy, right here, what you did about the findings you found in the data part of the note. And this includes nursing interventions such as administering medications. For example, pain yung focus natin doon. Then ilagay natin sa action is we administered medications, we call the doctors, or we reposition the patient. Ganun. Next slide. And finally, the last part of, not the last part, or next is the last letter of the acronym. So response, evaluation phase of the nursing process and describes the client's response to any nursing and medical care. So this is where you write the patient responded to your action. So balik naman tayo sa ineffective airway clearance na makita na, pwede natin ilagay dito na yung O2 saturation ni patient is nag-abot siya to normal levels like 25%. Yung RR nag-normalize na siya with an RR of 12 to 20, ganun. Pero we specify kung ilan yung RR natin and so on. And pwede rin tayo maglagay ng subjective cues dito like the patient verbalized na nakakahingan ako ng mabuti nurse ever since nag-suction mo yung airway ko, ganun. Sure. So yun yung response. And then next slide. So here is an example of a sample FDAR. So ang FDAR nito is pain. So pain. The focus of this problem is pain. So notice the way how the DAR are written. So ganito yung siya i-write. So first, of course, katulad sabi ko kanina, first column, date and time. So here it states that it was done in May 20, 2010 at 8 p.m. So afternoon shift pa rin. Maybe the patient complained of pain. So nasakit to yung katawan niya. Then, okay, dito tayo sa DAR. So, let us remember again yung DAR, di ba? Data, action, and response. So sa D, maglagay lang tayo siya ng letter na D for data. Then we narrate narrate the cues that are relevant to the focus problem, which is pain. So here we say reports of sharp pain on the abdominal incision area with a pain scale of 8 out of 10. So siguro ito si patient bago lang siya post-op to siya. So may pain siya doon sa kanyang incision area. So 8 out of 10, so may pain scale with facial grimacing and with guarding behavior, restless and irritable. So makita talaga natin na in pain talaga yung patient. So that is our data. Next, for A, action. What did we do in order to solve the pain of our patient? Here we say, encourage deep breathing exercises and relaxation techniques para mawala yung mind ni patient sa sakit. We administered pain medications such as Celecoxib 200 milligrams IV. Then we position the patient comfortably and safely. So yun yung mga actions na ginawa ni nurse in order to minimize the pain. And then for the last, yung R, or yung response. So how did the patient respond to the treatment, to our action? So the patient reports pain was relieved with the pain scale of 2 out of 10. Usually when we do the FDAR, itong R, what I meant to say was, usually kung mag-FDAR tayo, itong R, late na natin ito masulatan because in order to write a response, dapat meron ring change of behavior yung patient. So for example, may pain si patient yung sa very beginning and then hindi pa yan na siya na-solve. So hindi pa talaga natin ito siya pwede ma-fill upan siguro, or unless kung end of the shift na, tas in pain pa rin siya, then dyan na siguro natin malagay na the patient still reports of pain. Then magagay naman tayo ng pain scale. Tapos kung ano na ba yung call of action natin, like nagtawag na ba tayo kay doc ko ano ba ang kailangan gawin kasi hindi nag-subside yung pain niya. Which is hindi pa siguro kasi nagbigay man tayo ng ng pain meds, pero you get the idea. And then after that we put the name, yung our name, so student nurse, then with the CS signature and nurse on duty. Ito kasi naka-write to siya sa document, pero dapat talaga sa FDAR, can you see this white space sa right? Hindi dapat yan siya makita kasi pwede yan siya lagyan-lagyan, katulad ng sabi ni Miss yung other PCI ko na kasama kanina na hindi talaga dapat tayo mag-leave ng white spaces kasi pwede yan siya lagyan ng mga notes na hindi tayo yung nagsulat. So what we can do to prevent this is maglagay tayo ng line. Can you accept Ms. Adava? Ay, tama ba? Hindi yata ako mukha. Okay. Anyway, mag-write ka lang, mag-draw lang tayo ng